Everyone, I'm Deanna, President and CEO of the Washington County Chamber. I want to thank you all for joining us this morning. I know that it was a quick announcement, but really pleased, and thank you all for prioritizing this conversation. As I said, we have over 109 people registered to have this conversation. If you know of others that weren't able to attend, again, we're recording that, and we'll make sure that that information is made available to you. I do want to take a moment to thank and recognize the other 8 chambers of commerce that make up the Washington County Chamber of Commerce partnership. We have Debbie of the President and CEO of the Tiger Chamber, and my co-host this morning, Kevin, President and CEO of the Wilsonville Chamber, as well as Chair of the Washington County Chamber Partnership, Roy, President and CEO of the Tualatin Chamber, Corey, President and CEO of the Sherwood Chamber, Juanita, Executive Director of the Forest Grove Cornelius Chamber. The Banks Chamber and the North Plain Chambers are also part of the partnership. Not sure whether they have representatives with us here this morning, but wanted to make sure to recognize them as well. I want to thank Washington County Chair Kathryn Harrington for joining us this morning. I'm sure many of you are aware that there was a conversation that took place on Tuesday during a county commission work session with mayors from around the county, and the discussion was regarding the impact the Delta variant has had on our county-wide healthcare system. Chair Harrington agreed to convene with us today to provide additional context to that conversation, as well as to provide an opportunity for our restaurant industry to provide critical feedback and input into the deliberations currently underway. We have a lot of participants this morning, so thank you again for taking the time. Due to time constraints, we will be prioritizing comments and feedback from members of the restaurant, eating, drinking industry. If you are not associated with a restaurant but want to comment or provide feedback, please use the chat feature. Chair Harrington is going to begin our program this morning by providing a backdrop to the discussion that occurred on Tuesday, and any other information that has transpired since then, which it's amazing. It's only been, 48 hours, and it seems like light years away. I would ask that you all remain on mute until her comments are complete. We'll open it up for questions and comments. Any questions before we get started? Just raise your hand, use the raise hand feature. I am not seeing any raised hands. Debbie, do you see anybody? All right, let's get started. Chair Harrington, you have the floor.
Thank you, Deanna, and please only give me 5 minutes. Thank you everyone for being here. And I don't use that phrase often enough, so thank you. Please know that. I want to recognize that there are additional elected officials in today's meeting. My colleague, Commissioner Jerry Willey, Hillsborough Mayor Steve Calloway, Hillsborough City Councilor Rick Van Beveren, and at least Tigard City Councilor John Goodhouse. There may be others, but those are the last time I looked at the participant list a few minutes ago. I appreciate the willingness and responsiveness of the various chambers for meeting with me yesterday afternoon, as planes and other kind of variant has changed. This is not the month of August that I wish we had. A lot of people are getting sick and people are dying, and that includes children. We, in essence, are dealing with a humanitarian crisis, though I haven't looked that up in the dictionary to make sure I'm not overstating the case. On August 6th, the governor convened all the county chairs and judges across the 36 counties to lay out that the Delta variant was here in Oregon. The numbers were escalating rapidly, and reminded us that the counties had full public health control. From that, I moved forward and asked my colleagues to consider enforcing a mask requirement. That was on a Tuesday. I can't remember the date. The following day, the governor announced a statewide mask requirement. On Monday, this Monday, the 16th, the governor reconvened the county chairs and judges and brought in additional health experts. I understood from the August 6th meeting via a question that I asked that OHA Director Pat Allen answered that our regional hospitals here in the Portland metropolitan area are the backup to all the other hospitals in the state. The data point was of the number of people going to hospitals in Jackson and Josephine County, 20% of those patients were being transferred to our hospitals. So like it or not, we bear the burden. And I conveyed that people up here are unhappy about that because, as you know, Washington County residents have worked hard to get vaccinated and follow the rules. And your businesses have tried to follow careful rules as well. So this past Tuesday, based upon the alarm that was sounded at the state level and data that the OHA public health economist outlined and that I did following subsequent Q&A with him on Tuesday morning to make sure I understood what the data was telling us, I put forward a proposal to my fellow colleagues on the Board of Commissioners to consider restricting dining to outside only dining. As the economist, the public health economist outlined, that is the only technique that all prior surges have demonstrated works at reducing the case numbers. And he expressed that we would need that to be in place for 2 weeks to affect the numbers and for 4 weeks to enable the hospitals to catch up. I invited the mayors to that meeting so that they had the opportunity of hearing the same information from our public health team. Opinions were varied. You can watch the video of that meeting. It's on YouTube. Some of the mayors seemed surprised by the data because it hadn't been shared with them yet. I also learned through that meeting on Tuesday and subsequent conversations that state legislators weren't aware. So I feel the heavy burden of, even though I'm not a public health expert and I'm not a hospital expert, I feel the burden of needing to communicate that there's a dire situation to everyone in our community. Things have been very fast moving, both the devastation of this virus in our community, but also what possible options do we have, not only the authority to put in place, but to examine what the impacts are. And I have tremendous respect for not only my colleagues on the Board of Commissioners, but also in other elected officials to be examining those lenses. So let me be clear. We do have a humanitarian crisis, but we want to ensure we're doing our best to protect lives, especially for kids who are just about to start the school year, but also to preserve our economic recovery. None of us wants to impact your ability to run your businesses. None of us do. So what I'm about to say is new information. You can and should, well, go ahead and watch the governor's press conference at 11. She'll tell you more. The one thing that I will say is she's not going to put in place a shutdown. Our public health, our regional public health team would like to see a state shutdown in order to help the hospitals. That is not going to happen for a lot of really good reasons, okay? What could we put in place restrictions on businesses? Yes. Could we do variations on a theme? Yes. But guess what? All these different options have impact to you and your business and to those of us who have gotten vaccinated and follow the rules. So I sit here today, back to the point that I was at 2 weeks ago. Next Tuesday, I've asked our staff to put forward information before our board to enforce the mask requirement. That will protect all of our workers and allow your businesses to continue to operate just fine. So that's brand new information. I won't pre-announce all the other things that the governor will be announcing at her press conference at 11. And I'm sorry, Commissioner Willie, if I'm surprising you with any information. If cities want to do more, they possibly could. But I sit here today, I'm no longer advancing the ask to restrict dining in any way, because this surge, this humanitarian crisis is underway. And I don't believe that the problem is a state level problem. And doing something just in Washington County is not going to be enough to change the situation for regional hospitals. So I accept that there are limits to what we as elected officials in Washington County do. It's a horrible choice to be in. So I've exceeded my 5 minutes. Thank you, Deanna, for giving me this time. There is copious amounts of information available on the website, coronavirus.oregon.gov. I apologize for not having the energy in these last 12 hours to be able to rattle off the latest data about how many ICU beds are available, where are we at with vaccination rates for all the different demographics. It's all there. I believe we're here to listen to your comments of concern about potential impact of measures. And so I want to give the floor back to you, to Deanna and Debbie.
Thank you. Even though I think everybody was on mute, I heard a collective sigh of relief. I'm not sure how, but I did. You know, that obviously that was one of the reasons that we brought this group together, was the discussion regarding a direct impact to restaurants. So thank you for providing updated information that certainly helps our restaurant dining industry understand sort of where things are at this point. The one thing I would ask, just because, you know, frankly, it's been a little bit of time, just reiterate what when you say, you know, we're going to be enforcing the mask requirement. Can you just run down what that means and just remind us what that includes?
Well, I'm asking my colleagues to approve such a thing. So it's not in place yet. So, you know, there are times when time just overlaps for me. You know, as I've been thinking these last 18 plus hours about different factors, I'm reminded that, wow, we just did this in June, but it was June of 2020. So what does mask enforcement mean? It's exactly what we did back in the spring of 2020. No, this is not a capacity limit. No, this is not a capacity limit. No, this is not a capacity limit. Instead, we already have a state requirement that everyone be masked when they're outside their home, whether you're indoors or outdoors. What I'm concerned about is making sure that our workers are protected. So how does it affect you? I want you to ensure that your employees know they need to wear a mask. Just like as restaurant workers, they have to wash their hands at least twice after using the bathroom. Just like people have to be over the age of 21 to get an alcoholic drink. Please let your employees wear a mask. they have the opportunity to complain. We will have the same level of opportunity for them to complain. And then just like our staff did in 2022, this proposal is that on a complaint basis, our staff will follow up, be sure to make sure that businesses have education and know they need to do this. And then with a second complaint, we'll follow up with the businesses again. And with a third complaint, that's where a civil fine would come in.
Thank you for that. So what I'd like to do is first ask any of my other chamber colleagues if they have any questions that they would, or comments that they would like to make before we turn it out over to our participants. And just use the raised hand feature if you could, please, just because I don't oftentimes see, and Debbie's going to help me see.
Yeah, I can't raise my hand since I'm a co-host, so I'll just dive in there. Chair Harrington, can you clarify the mask enforcement? So I understand that on the employer side, not enforcing mask requirements for employees, there's this complaint-driven system. Does that also apply to the customer that's coming in that refuses to wear a mask? Is that also part of the complaint process?
Well, patrons can complain to us that they see other patrons not wearing a mask. But I think our staff just wants to make sure that you have, like you did before, signage that says, please wear a mask. And that's the best you can do.
And there
We're
has
not the police. We
Right.
don't want you to do that. We
Just
don't want you to feel like you have to. Sorry.
Just for everyone's knowledge, I think OSHA and OHA, there was just a release like a couple days ago where there is a new 8x11 mask sign that you can print off and post at all your entrances to help with that.
Thank you for sharing that, Debbie. Really, all we're going to be doing is enforcing the state requirements. Right? All you can do is do the reasonable thing of making sure people know that they should wear a mask. But you can't make them put a mask on their face.
All right. Other questions from my chamber colleagues before we go to our participants at large? All righty. So again, please use the raised hand feature so that Debbie and I can scan and see. We also do have questions that are coming into the chat. Anybody that raising their hand? Well, this is a whole different conversation, I would say, than people anticipated having this morning. So,
Deanna, could I recognize that there are multiple questions in the chat where people
Absolutely.
are trying to confirm their understanding?
Perfect.
You are correct in understanding that there is a state requirement that we all wear a mask whenever outside our own home. Okay. The question is, how are counties enforcing that? And so what I am going back to my colleagues on is to ask my colleagues to support mask enforcement. And the level, it'll continue, it'll just like before, it'll be complaint driven. We prioritize protecting workers. So we're not going to be out there in parks writing citations of people that don't have masks on, right? Or libraries or any place like that. It's really about the opportunity for workers to be protected. Right? Reasonable people should do reasonable things. Is that clear? Does that answer these questions?
I believe so, yes. Tom, did you have a question? Could you just introduce yourself prior to asking your question?
Yeah, hi, this is Tom Danowski, Oregon Wine Board. I just put my question in the chat, just asking if the person who mentioned the OSHA website with a link to a sign about masks, if they'd share that, that'd be great for us to spread that around.
That was Debbie from the Tiger Chamber, and she's on it.
Thank you, Debbie.
Any other questions in the chat that are related to something different, a different question than the chair has already addressed?
Yeah, there is a clarification. What
Okay.
the governor announced on Wednesday, the 11th, that was effective Friday, the 13th, was that masks are required for indoors. You are 100% correct in understanding that. Our public health team is now recommending that we all wear masks indoors and outdoors. Okay. What I will be taking forward to my colleagues to consider approving is enforcement for that indoors aspect. We don't have the capacity to enforce everywhere. We don't have the capacity to enforce everywhere the indoors exists. What we're trying to do is protect our most vulnerable people, the people who don't have these necessary choices. So it's just about protecting you as business owners and your workers, just like for our own employees. The best you can do is have a sign at your door that says everyone's required to wear a mask. And of course, there's the exception for when you're eating and drinking, right? That's in those rules. To make sure your employees are appropriately masked as well.
There is a question regarding vaccination. I won't read the entire question, but just where, in terms of going back to increasing, the focus on getting people vaccinated, where's the county on that?
So we have not let up on the messaging about getting people vaccinated, and we continue to be very focused to increase vaccination rates for those sectors that have our lowest vaccination rates. We're all leaning into having the FDA approval, general approval for vaccinations. We are moving forward, as the board is aware, in requiring employees be vaccinated. The governor has already announced that healthcare workers are required to be vaccinated. Our lawyers are diving into that rule to see who that applies to. It's complex, unfortunately. I just learned this morning that for that healthcare requirement, the date is October 1st. And if they haven't been vaccinated, if they go with Moderna, today's the deadline for them to get vaccinated in order to be fully vaccinated by that October 1st deadline. It's complicated. God, I'm so sick of that word. So I'm not going to pre-announce what the governor's going to announce, but she's already asked employers to please require vaccination of employees. And that's happening in many places.
Excellent. Thank you for that. We have a question from Erica. Erica, would you like to unmute?
Sure. Erica Palmer, representing the Independent Restaurant Alliance of Oregon today. I have two questions. One is shutting down restaurants or other public spaces is an old tactic. We have new tools. I'm wondering if there has been any consideration given to vaccine mandates for public spaces. And second question, restaurants have been impacted by this pandemic dramatically for the past 18 months. even without mandated closures, lack of consumer confidence, increase in supply chain costs, and a wide variety of other factors have led to 18 months of incredible debt service. Is there any consideration by the county or other organizations within the state of Oregon to provide financial assistance to restaurants and bars?
So unfortunately, we're not in a position to act on all of the financial implementation options that folks can articulate. As I met with your chamber executive directors, thanks to Deanna's organizing yesterday, we were just talking about, well, what if we required vaccinations, proof of vaccination for indoor dining, right? Puts the burden on the unvaccinated. If you don't have a vaccine, you don't get to eat indoors at a restaurant. And what that would involve in terms of providing that card check person or bouncer for all
numbers. Please re-enter your meeting ID followed by
for all the restaurants here in Washington County alone. And, adding up of those dollars, we just, even with the ARPA dollars, we don't have enough money to cover that expense. So your first question was, so I'll leave that as my answer to your second question. Maybe the Fed can print that money, but we don't have that in Washington County. Vaccination mandates in public spaces. What I don't want us to do is do something as just one county of 36. This problem is not unique to Washington County. And so, if there's going to be proof of vaccination in any kind of spaces other than in employment buildings, because businesses can do that already. You don't need more permission to do that, nor do we as a county for our own buildings. The state and the federal government needs to put that together. We are just not equipped to do that. And I don't think you want us to take money away from other important parts of our service to you in order to
welcome to Zoom.
All right.
So I'm not trying to dodge the question. I'm really trying to give you a clear answer.
All right, Michelle.
Hi, thank you. So the first thing I'd like to say is a statement rather than a question, and that is, I'd like to encourage everyone to stop focusing on restaurants first. I'm not convinced that restaurants are the first place that we should be looking to stop the spread. I was at an event 2 weeks ago, and it was a large gathering where we thought everyone was vaccinated. It turned out that 2 people weren't, and they slid in under the radar. So I have a large 18,000 square foot venue where we keep people safe. They're spread apart, they're masked. I have masked police. I'm doing everything right. Stop making us your #1 target. Start looking at other places, please. So that's my statement. Now, my question is regarding enforcement. I have come up against OSHA, OLCC, Washington County. I have talked to everyone. The enforcement is inconsistent. And a lot of that has to do with not having clear, concise, written understanding of what you're trying to enforce. The question I have right now is, what does it mean to be having your masks indoors for restaurants when you can take them off when you're eating and drinking? Does that mean while you're actively eating and drinking? If I have a cup in my hand while I'm walking around, is that okay? Does that mean while I'm chewing, that's okay? And so I get into these conflicts with my customers all the time, and then I end up being a mask bouncer, and I don't want to be that. So those kinds of things, when you're developing your enforcement policies, I would really encourage you to please make sure that those things are clearly articulated. And if you have an answer for me right now on what those things are, or if you can point me to something in writing, that would be really appreciated.
So we're only going to be enforcing the state-defined rules. Okay. And So as clear or unclear as those state rules are, there you go. I, like you, would interpret that if I'm in a restaurant eating, from the point of that drink being on the table to the point of my getting up from the table, that I'm actively eating whether my jaw is moving or not, right? So
It's a little harder for bars, I think, which are classified in Oregon as restaurants, right? And it's a little harder for them to monitor this, I think, than a sit-down restaurant.
we are not asking you to be the mask police. We do not want you to be in that position. I agree that it's too hard for restaurants and bars to do anything more than make sure your staff can wear masks. And believe me, it's hard to hear people when you're wearing a mask, right? I don't envy servers and bartenders needing to wear a mask. All I'm asking you is try your best.
I believe in the mask policy for the record, and we're trying, but I thank you very much.
Thank you,
I'm
Michelle.
sorry, it's complex, Michelle. This virus is complex. It's a pain in the neck. I hate it. And Jerry will tell you, I use that word very sparingly.
Kevin, you're up.
Thanks again, Chair Harrington, for being here and allowing us an opportunity to kind of talk this through. If the assumption is that our governor will be asking businesses to step in more on vaccinations, I've put in the chat the latest site that I think is accurate for Washington County. Is it possible, as you get back with your public health team, that you can clarify that that will have the most up-to-date information? Because as chambers and reasonable business that choose to want to help collaborate, it is a very frustrating experience for a lot of our employees to try and figure out where, in fact, I mean, if you do a Google search right now, it says maybe on all the pharmacies and everywhere else, and that makes one more barrier to try to get people who want to be employed and their employer says, yes, we're going to vaccinate, to try to find solutions. So if we have one place to go, that would be terrific.
And our team has worked very hard to try and be that one-stop shop for you. I think Matt Craigie is on this call and he can help Commissioner Willie and I try to figure out how the team can make information as clear for you as we're able. Thank you for your understanding. Really appreciate it. The team is really, your Washington County team is trying hard to help you.
So Chair Harrington, there's one question that's directly related to the county in terms of a specific question about property tax in the chat. I'm just going to read it and give you an opportunity to respond. It says property tax bills will mail out in the next 7 to 8 weeks. In 2020, when we were shut down, Washington County offered no assistance on relief, such as the simple steps like no interest on unpaid property tax for 12 to 24 months. Anything is helpful when interest is 16%. Is there any consideration to provide any assistance on interest delayed on property tax bills?
So I'm going to use that word that I don't like, complex. Commissioner Willie, I think if I remember right, weren't we informed about there being all kinds of ORSs, limitations on what we can and can't do on property taxes? We'll try and make sure that the FAQs, the frequently asked questions material, is easily available and does its best to outline what the limits of consideration are. It's hard. I don't have a good answer for you right now.
I'll just add on to that in terms of another question regarding specifically the restaurant industry that's been probably the hardest hit. although, you know, we all feel the pain. Any consideration on licensing for restaurants or the number of, you know, permits and things that they need to get through the county? Again, I know those are important revenue streams for the county. Just, you know, is there any conversation that might come up around that?
So the licensing that we do is following the state requirements, and our license fees on that are just cost coverage. It's a very tight budget as it is for covering all of the services that you and our constituents need. So I don't see that particularly changing. I think what our county team is trying to do, and Commissioner Willie and I are both supporting it, is we're trying to make sure that out of the limited ARPA dollars that are available, that we use those for public health and for economic recovery. And that's one reason why we're trying to be very prudent about what we do with those dollars for public health purposes, you know, in response to this pandemic. So for example, as we in our chamber conversation last night or yesterday between 4 and 5, we were doing the back of the envelope conversation or computations about what it might mean if the county had to pay for those card check, vaccination card checks, right, for restaurants. And we very quickly burned through a lot of money. That would be money that would not be available for business grants. You know, I don't want to bite my nose off to spite my face. So that's where we're trying to be very prudent about how we go about this. So I think I need to leave it at that for the time being.
Thank you. I appreciate that. Another question is the mask mandate seems to allow face shields. I know, you know, I can't remember the timing during the pandemic when all of a sudden it was like, nope, those don't cover. And so you saw folks that were kind of depending upon those to switch to masks. Do you know where we're at right now in terms of the recommendations?
No, I don't. I'd have to look at the rules just like you. Sorry.
Thank you. Just want to bring it up. The other thing I guess I would mention, as you said, you know, Matt Craigie, the Economic Development Manager for Washington County, is, I believe, still on our call today. I know we had to jump off a little bit early. But, you know, Matt and the County Commission was great about providing, you know, and standing up the business recovery centers throughout Washington County. And, you know, there was a provision of free PPE that was part of, you know, what we were helping and to support businesses. And I know that our BRC, like the others, got to a certain point and we're like, well, you know, we're moving out of this, we're done. As I understand it, I know that Matt is working with others to ensure that we still have a supply of free PPE for our businesses, especially, you know, with these new mask mandates. You know, I'm not sure where the supply is, but my guess is that we're going to be in those situations again. So is it Lawson that's asking a question? Are you raising your hand, Lawson? Where'd you go? Okay.
I'm right here.
Oh, Deanna.
Oh, there you are. There you are.
I'm sorry. Yeah, I just had we've talked a lot about masks, it's a state mandate and we're following it because it's a state mandate. But at the beginning of this conversation, there was discussion about closing indoor dining and how the governor's put it back on the counties. And it was talked about very briefly and we have not discussed that since. Is that something you are discussing and is a potential possibility from the county to shut down indoor dining?
I have taken that off the table from me.
Okay, that's what I
That
wasn't
is
understanding.
not to say that another county commissioner won't bring it forward, but I'm the one who, in response to the information on Monday,
Okay,
with further clarification Tuesday, drove that proposal in to our meeting on Tuesday.
right. I
And
was
what
wasn't
I'm
clear.
telling you here today is I've taken that off the table,
Okay.
as informed by our public health team.
Okay, perfect. Thank you.
Yes, we started out with that, which then allowed us the opportunity to pivot, as we're so good at, to other questions that might have been related to the county and where the county is going. So that we didn't circle back around to say that that had been taken off the table for those folks that joined a little bit after that batch. So thank you for that opportunity to clarify, Lawson.
Appreciate it.
You bet.
So Deanna, can I chime in here?
Please do.
So the sign from the OHA, which I did put the link in the chat, when I just went back and looked at it, it says masks, face coverings, and face shields are required. So it would appear that face shields are allowed based on that. I think one of the other common themes, Chair Harrington, I'm seeing in the chat is questions regarding either mandating vaccines for large outdoor events, or is there any thought of restricting capacity on large outdoor events? If I were to kind of summarize what I'm seeing in the chat.
So you have two county commissioners on this call. What I have said, and I will continue saying, I do not want to see capacity restrictions of any kind in place as just one county.
Thank you.
And
So
I believe Commissioner Willie tried to unmute himself and contribute something earlier. So if I might be so bold as to give him the mic.
Thank you,
absolutely.
Chair. Yeah, a couple of responses. One is I completely agree with the chair. We are not having conversations about restricting size of outdoor events or indoor events. But with that, of course, there is the responsibility to emphasize and probably require masks be available for all the participants, whether it be indoors or outdoors. I think that's only prudent. Yesterday, I was told that we are accustomed in our masks over the last 15 months or so that we have homemade masks and we have a variety of kind of tailor-made masks as well as the KN95s and others. I'm told that with this particular type of COVID that we're dealing with now, KN95s is the preferred mask because it provides you with the greatest degree of protection, both for you and for those that you are around. And so I think what I would encourage also is that, and I'll get more confirmation from our public health people on this, but I would probably encourage that if you have made a mask at home, that you might want to consider not using that mask. Use a certified, if you can. KN95s, they're certainly not fashionable, but they are definitely effective. I believe the chamber still has an inventory of KN95 masks for free. So if you'd like to get some of those for your home or for your businesses, please do that. But that's, we have got to make sure that when we do wear a mask that we are using the most effective mask that we possibly can to stop the spread. Remember, this spread is 8 times more, it spreads faster than any of the previous COVID. So we have to be more diligent about the type of mask we use as well.
Thank you, Commissioner Willie. Michael, I see you have had your hand up patiently. You're still on. You need to unmute. There you
Okay,
go.
I think I'm there. Am I
You-
there?
you-
This is the first time Zooming. Yes, I think about where we're at now concerning the mask itself and then concerning our customers. We're in an era right now where a lot of people don't cook, and we are serving hundreds of people a day. And whether it be takeout, whether it be dine-in, whether it be outside dining, literally hundreds a day. And we're also a wholesaler, so I am roasting thousands of pounds of coffee and shipping those out on a daily basis. What I don't understand, and maybe somebody can clarify the science here for me, and that is, my wife was an emergency room nurse for years. And I don't understand where you come into a dine-in area and you take your mask off and how that is supposed to do anything medically. Where is the science here?
Okay, let us be clear. We're not saying it is safe for vaccinated people to dine without wearing a mask. We're not saying that. No public health person is saying that, and I'm not saying that. So the Delta variant is the dominant variant now in our state. The prior variant that was dominant had what they call an R0 of 3, which means that a person who had COVID could infect 3 other people.
I'm
This
not arguing that.
Yeah,
I'm not
I know,
arguing
I
that.
know.
I just
So
want to
the
know where
Delta,
the science is.
that's what I'm
If
trying.
somebody takes their mask off and you've got a restaurant full of people without masks on and they're eating, it's like me painting a car in a clean room and being fully masked with a respirator, and then just decide to have a sip of coffee and take that off. I would die, if I inhaled those fumes. So I just want to know the science. I don't want to know the song and dance here.
So I can give you what little information I can give you, but I'm not trying to be that science expert. So I'll be brief. With the Delta variant, the R0 is 8. So an infected person can infect 8 others. Our public health team believes that people are best, whether you're vaccinated or not, you are at risk by this variant. Public health has recommended a state shutdown. They're not going to get that. Okay? So they think you should wear a mask all the time when you're outside your own home. That's what they recommend. No one can guarantee that you're not going to get sick if you're doing something other than wearing a mask. Okay? But that's the extent of it. I can't protect everyone. I just can't.
No one's asking anybody to protect. People die every day. That's just part of it. The thing is that for me and for my family, there's a good majority of us that have had COVID, and we were tested. We went through all of the stuff. We got well. I'm near 70 years old, and I know at least 30 people that have had COVID. I've been tested. I am full of antibodies. Now, if I take that vaccine, there's a good chance that I could compromise myself with the amount of antibodies that are in there. This is science. This is not somebody just repeating stuff like wear a mask and then take your mask off and eat, and then none of this makes scientific sense to a guy that employs nearly 100 people with full benefits, retirement. I've been doing it since I was 18. And now I am confused. And I am fairly smart, believe it or not, but I'm confused how this is going to help.
I don't doubt your intelligence and everyone else's intelligence. The CDC has continued to learn more. This Delta variant has changed everything. It doesn't matter if we've had COVID or not. There are lots of stories that you can see on the national media where people have been sickened by COVID previously. They've been sickened by this Delta variant, and the science is there to say that even vaccinated people can get the Delta variant, even
Right.
vaccinated people can transmit it. So
Absolutely.
I know I cannot represent the science adequately. All I can tell you is what public health has recommended to us as we serve as the public health board for the county.
Thank you, Chair Harrington. I think we just have a few minutes left, and I want to make sure that if there are any final questions, we can make sure to get those in. We do have one in the chat from Donna Gustafson. She is a Forest Grove City Councilor and a restaurant owner, and she says, I agree, restaurants are unfairly punished and affected by not only the mask mandate, but the pandemic itself, especially the small businesses. Has there been a recorded factual study based on the infection, where the infections are happening? Are they family gatherings, churches? Do we really know where things are happening?
So this is where I made the recommendation on Tuesday based upon the best science and what the data shows. As the public health economist outlined for us in the presentation Monday, and I asked for further clarification. Every surge until this latest Delta variant surge occurred before we had vaccinations. The facts show that the majority of people showing up in the hospital right now with COVID are previously unvaccinated people. Some of them are vaccinated people. Right? The latest OHSU graphic shows that 97% of the people are unvaccinated. The prior surges show that the common thread of actions that have been taken was reducing dining to outdoor only and takeout. But looking through all of what that entails, what it impacts, we cannot guarantee that that will protect people's health while preserving our fragile economic recovery. So since I sit here this morning with new information that says there will not be a state shutdown, I am pained by the fact that people may still get sick through dining, but they may not, right? So all I can tell you is I am not promoting an action that will restrict dining. And that's based upon the best informed science and public health that is available to me in my capacity as a member of the Board of Commission that serves as the Public Health Board for Washington County.
So thank you very much. We are about 4 minutes away from the 11 o'clock governor's press conference. Want to make sure everybody has an opportunity to change channels, if you will. I would also just remind you to save the chat. There's a lot of good links in there that were provided, a lot of good information. Please be sure to save the chat. And I want to, again, Chair Harrington, thank you so much. Thank you to the other commissioners and other elected officials that joined us here today. I think it's always helpful to have an opportunity to hear feedback and to help us navigate through what you've aptly defined as a very complex situation. We appreciate your leadership. We appreciate the opportunity to come together in this way. I want to again thank our other chamber colleagues, and and we appreciate the support of all of the business community to our local chambers of commerce. I mean, that's where you're going to get the most up-to-date information in the quickest fashion. So really thank you again for all of your support, and we will wish you a good rest of your day and thank you again.